I'm gonna go ahead and gather my equipment, wash my hands, provide for privacy. Hi, I'm Lindsay. I'm gonna be your nurse today. Can you please state your name and date of birth? Perfect. I'm gonna verify with the wristband. So today we are gonna be doing a wound dressing change. We are gonna do this to promote healing and decrease the risk of infection. And before we begin, I'm gonna make sure the bed's at a comfortable working height. You've got your bed locked, the area is clear of any hazards, and you do have your call light with you. Okay, now I'm gonna go ahead and rewash my hands. And I'm gonna check the provider order to make sure we're doing the correct procedure. So I'm gonna be doing a wound change. Perfect. And again, we are doing this to promote healing and decrease the risk of infection. Do you have any questions about this or concerns? No? Okay, perfect. All right. And then on a scale of 0 to 10, 0 being no pain and 10 being the worst you've ever felt, how would you rank your pain? Okay. And are we in a comfortable position right now to be doing this? Perfect. All right. Wash my hands, get on some gloves. Okay. Okay, so I'm gonna go ahead and look at the wound. Okay, I'm gonna make sure to promote as much privacy as possible, and I'm gonna loosen the corners of this wound. Okay, and I'm gonna pull off. I'm gonna assess for any drainage, color, or any odor. All of it looks pretty well, so I'm gonna discard this. All right, and then I am going to look at this wound, and it is a stage 2 wound. There is signs of healing because it is pink and there's no oozing, swelling, or any foul odor coming out of it. So this wound is healing. All right, now I'm gonna go ahead and take off my gloves, wash my hands again. I'm gonna put on more gloves. Okay, and then I am going to assess the wound using a sterile Q-tip. And I am gonna go ahead and put it at the deepest point and look for the depth. So this wound is about 5 centimeters deep. I'm gonna discard this. I'm gonna measure the width. It's about 1 centimeter. And then the length is about 12 centimeters. All right, and like I said before, this wound is healing because it is pink and there's no oozing or visible signs of infection present. Now I'm gonna rewash my hands, get some more gloves on. Okay, now I'm gonna take these gloves off and I'm gonna prepare my supplies. I've already got my dressings in here, and then I'm gonna get out a dry spray to use for changing, and then grab one of these as well. Okay, I'm gonna put some saline on here. Perfect. All right, and then now I'm gonna go ahead and wash my hands and don new gloves. And if I were to be putting medication in the wound or around it or anything like that, I would do the 3 checks and the 11 rights before doing so. Okay, I'm gonna pinch at 4 corners here. I'm gonna go ahead and swipe, discard that. I'm gonna pinch at 4 corners once again, and I am going to swipe and discard that. Now I am going to be getting a couple more here. Swiping the area, getting rid of that. And then one more for the other side. Just making sure I do the 4 corners. And I'm gonna swipe and discard that as well. Now I'm gonna get rid of my gloves, make sure I wash my hands, and I'm gonna apply the new dressing. First, I'm gonna get some more gloves on. Okay. And while my gloves were off and I was getting my equipment together, I did write on the piece of tape saying my initials and the date that this was put on. So now we're gonna go ahead and get a dry gauze, and we're going to package the area, and then we are gonna go get this one, cover the top, and then we are using that tape and using the window method if needed. So I'm gonna go ahead and do this side. Now, are you experiencing any discomfort right now? No? Okay. Okay. All right. And then tape this up. And my date and time initialed is on that wound as well, making sure it's all sealed. And how are you feeling right now? Are you having any discomfort, any pain, anything like that? No? Okay. All right, I'm gonna go ahead and take off my gloves, wash my hands. And I am gonna go ahead and cover back up this patient. And I am gonna document the patient received this wound dressing at 1400 in the abdominal region, and they had a pain on the scale of 0 to 10 as a 7. Patient reports no discomfort, anything like that, and the wound is healing and there's no signs of infection present. Now I'm gonna go ahead and discard my equipment. Throw away that. And all right, thank you for your time today. We're gonna come back in and check on you in a little bit to make sure you're not experiencing any sudden pain, anything like that. And if you need us sooner, then hit your call light. And thank you for your time today.